Good afternoon. I'm Dr. Kelsey Bergstrom, a pediatrician at Mercy Hospital. On February 13th, 2024, Allina Health announced its decision to close Mercy inpatient pediatrics and ICU and surgical services at the Unity campus, a move that will eliminate over 100 positions by June and severely limit access to necessary medical care for patients, especially children in the North Metro area. Allina has categorized pediatric care as non-essential, disregarding the clear need in our community. It is more than the closure of 2 designated pediatric hospital beds. Our capacity and the community's need is much greater than that. We see seasonal surges of illnesses when we are often caring for 10 to 12 pediatric patients at a time at our hospital alone, and at a time when all other children's hospitals are often full. Our fear as pediatricians is that the closure of inpatient pediatrics at Mercy will result in poor outcomes for children in the North Metro area, as they wait for hours or even days in the ER for a hospital bed to become available somewhere in the metro, somewhere in the state, and that's unacceptable. Allina has a choice. They have a choice to prioritize the well-being of our community's children. Instead, they are choosing to deny them access to vital hospital services. They have a choice to protect the jobs of dedicated healthcare professionals. Instead, they are choosing to eliminate these roles to protect their bottom line. They have a choice to deem pediatrics an essential service. Instead, they are choosing to turn their backs on children. This week, Allina Health notified my colleagues and I that they now plan to keep 3 pediatricians in the hospital to cover the newborn nursery and to provide daytime consults in the emergency department only. While it is a step in the right direction, it does not reinstate the most vital pediatric care that our services provide, which is local hospital care for children in the community. Today, we stand united to advocate for our patients. We call on Allina to fully restore inpatient pediatrics and ICU and surgical services at Mercy Hospital. Together, we will share our stories about what these services mean to our communities and what we stand to lose if they go away. We will then open the floor for a Q&A session where you'll have the opportunity to ask questions. Please welcome our first speaker, Gail Olen, a nurse at Mercy's Unity campus.
Good afternoon. My name is Gail Olen. I've been a nurse at Unity for about 39 years. And I've worked in the pre-post-op area for the last 19 years, and I love my job. I love taking care of surgical patients. Doctors and nurses work closely together 24/7 to care for patients at the bedside when they are most vulnerable. But it is uncommon for doctors and nurses to come together in the way we are coming together today. We are here today working together to prevent potential harm to our patients. We have serious concerns regarding the decisions made by Allina Health to close pediatrics at Mercy, with some modifications now, thank goodness, close the ICU at Unity and make it a special care unit, and closing surgical services at Unity. The community will be hurt by these decisions. We demand that these changes be reversed. The doctors, nurses, nursing assistants, and other workers represented here today want you to know of these proposed changes by Allina Health executives and how it impacts you and your families. The North Metro area where we work and where we call home is a wonderful, diverse, thriving community. It deserves the best health care possible. Allina Health's proposed changes put that in jeopardy. Community members deserve answers from Allina Health executives about the possible impact these changes will have. Among the questions we have, can the current understaffed EMS system handle even more stress without breaking? Today, ambulance transfers between Unity and Mercy hospitals take hours, even when the patient's status is critical. Reducing Unity's ability to care for critically ill patients will make this worse. Can our community afford to lose more ICU beds? Our hospitals every day are getting patients from rural Minnesota because of the lack of capacity. Reducing this capacity will have an impact on local care. If my child needs emergency medical services, what kind of care can I expect at Mercy Hospital? Will the North Metro no longer be able to care for its sick children? Why is Allina considering closing Mercy's pediatric department when it has a state-of-the-art mother-baby center? Is this the best for the community or best for Allina's profit margin? Unity currently serves a vital role for area residents who receive electroconvulsive therapy as part of their mental health care. Stopping these services at Unity is a great disservice to this vulnerable group, and Allina Health executives have yet to come up with a detailed plan to protect them. When patients need a hospital, they typically go to the nearest hospital to them. Unity continues to have pregnant patients come to Unity despite not having OB services for several years. How does Allina meet the needs of patients who require emergent surgical interventions? These patients will come to Unity despite not having surgical services, and we want to help them. Why close an OR that has had above forecasted surgical volumes for at least 5 years running at Unity? On any given day, we have 150 patients at Unity Hospital. Every day, the condition of some of these patients worsen. Will we be able to safely provide care for them under the new system where Unity no longer has an ICU or an OR? Allina Health says they are working on a plan, but they are not sharing those plans with the doctors and nurses whose job it is to keep these patients alive. These are a few of our concerns about the short-sighted decisions being considered by Allina executives. We ask Allina leaders, why are you ignoring your own mission statement that says we are here to serve our communities by providing exceptional care as we prevent illness, restore health, and provide comfort to all who entrust us with their care? Providing exceptional care, that's what we nurses, nursing assistants, and doctors want to do every day. The residents of the North Metro area deserve as much. Allina Health executives are putting this at risk. Thank you very much.
Please welcome our next speakers, Dr. Jacqueline Bender and Dr. Robert Mills, who are both pediatric hospitalists at Mercy Hospital.
Hello, everyone, and thanks for being here to support our children today. My name is Dr. Jackie Bender, and I proudly serve the children of this community as a pediatric hospitalist here at Mercy Hospital. Each and every shift, I have the opportunity to be with families as they work through the stresses of seeing their child sick and needing hospitalization. I then go to the newborn nursery and spend time with families as they experience the joy of bringing new life into this world. What an incredible resource it is to have care for our children right here in our local community. And what a pain it will be once it's all taken away in June with Allina's closure of the pediatric inpatient service. As a pediatrician and as a parent myself, I struggle to see any reason why children's health care should be the thing to be cut when a healthcare system is looking at their bottom line rather than caring about the needs of their patients. I struggle to think where our local families will seek care the next time their child wakes up in the middle of the night struggling to breathe from RSV or croup. I struggle to think about the long wait times at our urgent cares and ERs, where kids will surely pile up in the waiting rooms and in the hallways as our incredible acute care staff do their best to find themselves an inpatient pediatric bed somewhere in the metro. I struggle to think about what will happen the next time our wave of pediatric RSV comes and our hard-working children's hospitals downtown are overflowing with patients looking for care. We are so lucky in the Twin Cities to have our wonderful children's hospital. But the truth is, they too have a capacity. They often become full, and care in our local community hospitals, like the care being provided here at Mercy, will help to ensure that all sick children have a bed when they need it. It provides the comfort of quality pediatric care in our own neighborhood so that families can continue to function at home, care for their other children, and work their jobs while they juggle how to be there for their sick child. Being able to simply drive downtown to seek care is a huge barrier for many of our families. The closure of the pediatric inpatient service here at Mercy will put all children in the North Metro in a complete care desert, and it's unacceptable. Our children deserve better. Our children are our most precious and vulnerable patients. And as a pediatrician, it is in my job description to always fight and advocate for children's access to safe and quality care. This decision will result in worse outcomes for children's health in our area. And my hope is that Allina's decisions will begin to reflect the needs of their smallest patients instead of thinking about their bottom line. When this closure was announced, a talented writer in our community sent us this poem, and while the writer would like to remain anonymous, we felt these words were very powerful and needed to be shared. It's a parent's nightmare, a cough in the middle of the night, struggling to breathe, a child's clear fright. But where to go in a night that's so dark? Fear fills the minds, the choices are stark. For the nearest hospital recently declared, they've chosen for children no longer to care. The ads claim it's one of the best in the state. Might be true if your care comes with a good rate. Altogether better, they've posted everywhere. Yet you race past the hospital, no children there. Better, perhaps, but all just isn't fair when they've chosen for children no longer to care. It's true that children don't fill the cash drawer. It's true that adults are worth oh so much more. We serve our communities, their mission statement does state, but clearly only the ones with good reimbursement rates. Uniting to care for you, at the billboards you stare, for they've chosen for children no longer to care. It's profits they want and profits they need. Caring for children can't finance that greed. With executive salaries rising so fast, serving others is fine, but they really need cash. But is that nonprofit status they have really fair when they've chosen for children no longer to care? Again, thank you so much for being here to show your support for children in our area. Please know how badly our group of pediatric hospitalists would love to stay and continue our services to family in this area. Thank you.
Good afternoon. Thank you all for being here and showing your support. My name is Dr. Robert Mills. I am one of the pediatricians here at Mercy Hospital, and it's been such an honor and privilege to serve the children and families of these surrounding communities. My colleagues and I were devastated when Allina abruptly announced our jobs were being cut and the children and families we serve would lose a vital resource. This will undoubtedly have negative impacts on our surrounding communities, especially for low-income families and children of color. We know that poverty contributes to unequal access to care and health inequities. When looking at data from the Minnesota Department of Health, neighborhoods in just a few of our communities like Champlin, Coon Rapids, Anoka, Brooklyn Park, and Fridley have poverty rates for children up to 20 to 40%. And that's just within the 20-minute drive time from Mercy Hospital. That doesn't include the children we see from further away like Elk River or Cambridge. Some of these families may have issues with transportation, inability to pay for expensive ambulance rides, or other childcare needs, and cannot easily reposition to other children's hospitals as Allina would like the public to believe. We also know that African American, Hispanic, and Indigenous children are 3 times more likely to live in poverty. So for our children of color in these communities, this closure will only worsen the health disparities that already exist. Minnesota has been known to be one of the worst states in the nation for health disparities, and many organizations and individuals have been working hard for years to reduce these disparities in our state. Yet it seems Allina's solution to the problem is to create more barriers by moving healthcare access further away. Allina has indicated that this closure is for financial reasons, and it's clear they did not consider the human aspect of these decisions when looking at their spreadsheets. Sadly, this appears to be a pattern since less than a year ago, Allina was making headlines for putting profits over people by cutting off poor patients and children because of medical debt. Where is the accountability? I urge our community to let your voices be heard and tell Allina this is not okay. Our children matter. Our children are not just numbers on a spreadsheet. Our children deserve better. Thank you.
Please welcome our next speaker, Dr. Kara Larsson, a community pediatrician.
Good afternoon. I'd like to, first of all, thank all of you for being here.
all of you. This is a really important issue, and I'm glad to see you here. My name is Dr. Kara Larsson, and I'm a Allina pediatrician that's worked at the Coon Rapids Clinic for close to 25 years. I'd like to start by reading a statement written by Dr. Janelle Keplinger, a close friend and colleague of mine. Dr. Keplinger is a pediatrician who has worked at the Health Partners Clinic in Anoka for decades. Unfortunately, she was unable to be here today, but she had a story that she wanted to share. Tuesday, June 11th, 2002, is a day from my long career in pediatrics that I will never forget. It started out like any other Tuesday. I was in clinic, seeing patients, when I received an urgent call from one of the nurses on the pediatrics floor at Mercy. A 5-year-old patient of mine had undergone a simple elective procedure the day before. He was supposed to have gone home that same day, but needed to stay overnight because of multiple episodes of vomiting. Because of this, he was admitted to the surgical team, who was called about his condition, and an x-ray was ordered for the morning, Tuesday morning. You see, at the time, the Pediatric Hospitalist program did not exist. Although pediatricians were on call and could come in if needed, there was no one immediately available if a patient suddenly worsened. I was contacted by the nursing staff around 11:30 a.m. As his outpatient pediatrician, would I be willing to come in and evaluate him? I could hear the urgency and concern in the voice of the nurse on the phone, and I knew that this child was critically ill. I immediately rushed to the hospital from clinic, leaving patients still to be seen. By the time I arrived at the hospital 20 minutes later, the situation was severe. I immediately called the pediatric code blue, but despite the valiant effort of the code team, this beautiful child, who had so much potential and whose parents trusted our hospital to provide care for, died less than an hour after I arrived. Having a pediatric hospitalist involved in this patient's care could have changed the outcome for this child. This unfortunate, tragic event is what led to the creation of the Pediatric Hospitalist program at Mercy. This dedicated group of board-certified pediatricians has steadfastly served our community with minimal cost and tremendous value for close to 19 years. They have cared for thousands of our patients, thousands of our children from our own communities. We depend on the presence of these pediatric hospitalists in the hospital to guide the care for our children, monitor for the progression of problems, and respond to emergencies. They are experts in their field, and that expertise is what our kids and our communities deserve. So to the Allina administrators and board of directors who have the power to reverse this decision, I implore you, we implore you, do not turn your back on our patients. Do not turn your back on our children, and do not turn your back on the communities who need you now more than ever before. Thank you.
We'll now welcome our last speaker, Jennifer Kiley, a patient care tech from SEIU Healthcare.
Thank you. Hi, my name is Jennifer Kiley, and I'm a patient care tech at Unity Hospital in the intensive care unit, where I've worked for the last almost 13 years. And I'm a proud member of SEIU Healthcare Minnesota in Iowa. Here today to express my frustration with the planned closures by Allina. It's clear the people making these decisions aren't spending time with our patients and aren't acknowledging long wait times. These closures will only make things worse. Many people, including myself, love the community we've built here, and we don't want it taken away. The people here are family, both literally and figuratively. It's frustrating that those in power seem unwilling to consider the personal and human costs of decisions like this. Over the years, I've seen so many changes, and this may be the worst yet. People don't want to have to drive long distance in an emergency to get care, and they shouldn't have to. Patients having to wait up to 5 hours or more to be transferred to Mercy is unacceptable. There are not enough ambulances or EMS personnel to transport these patients. How is that okay? Our commitment should be the patients ensuring they get the best care safely. These closures would make that worse. This is going to hurt a lot of people that have lived in this community for years and have helped build it. It doesn't seem like upper management or CEOs understand or even care. The staff at Unity are amazing. I trust them with my own care and with the care of my loved ones. These proposed closures would mean we could lose incredible nurses, doctors, nursing assistants, and patient care techs. This community relies on Allina to provide safe, quality care in critical situations. Closing these units would negatively impact all of us. We're here today as healthcare workers, patients, and community members to say loud and clear, no closures. Thank you.
We can have our speakers step forward. We'll take questions.
For the patients who are currently in the ICU or using these pediatric beds, if they close, if these units close, where would they go? Like, what happens to them in the immediate future?
So as far as the pediatric patients, that closure is planned for June 12th. And their plan as of now would be to reposition all of that care to places like Children's Minnesota or Masonic down in St. Paul and Minneapolis. The issue is that those hospitals are often full and at capacity. So that's a great question. And I don't know that we've been given the answer to that quite yet, where those patients would go. As far as the patients waiting in the emergency rooms for care after this closure happens, many of those patients just remain in the emergency room, boarding there until a bed opens up. That can be hours, sometimes, over a day. And during that time, certainly pediatric patients that I can speak to, their quality of how they're doing definitely decreases. So it's something that is an urgent matter, and we don't have that a good answer for that. Great question.
And then you were the one who mentioned the great care desert. Where is the nearest ICU if this closes down?
Nearest ICU?
Mercy.
Mercy would be the nearest ICU when Unity closes. We, as a pediatric hospitalist group, have an inpatient care facility here. We do not have a PICU or a pediatric ICU. And so care desert for pediatric patients is if you needed an inpatient pediatric bed, your options would be, Children's down in Minneapolis or St. Paul, Masonic or Hennepin County, also in Minneapolis, or going up to somewhere like St. Cloud or Duluth.
I'll speak to the adults a little bit, if you don't mind. Yeah. I just want to express that the adults for ICU, their plan is to change the ICU to a special care unit. They model after the regional ICUs, SCUs. These hospitals in the regional areas have like 30 to 50, 60 beds. We have at least 150 patients at one time. And last week it was said more than once, there are no ICU beds in the city. So it's a shuffling game to get patients where they need to be to get the level of care they need. So we anticipate there's going to be issues with people getting the level of care that they need. They will be sitting on our medical units waiting to get to where they need, and that increases your risk, of course, to poor outcomes. So we don't have a clear plan on that from them as of yet.
So the capacity would go from like 150 now to 40, 50, or 60?
Well, it depends on how many patients have problems while they're there. The the SEU that they plan on having at Unity will be 16 beds. Right now, we're 10 beds of ICU patients.
Question for any of you who want to, I mean, you've probably seen the financial statements. Allina's been hemorrhaging money for a long time right now. They got to do something. If not this, then what? Have you thought about where, if they can't cut here, where are they going to cut? Because the only thing worse than a deteriorating hospital is a closed one.
I can speak to that just for a second. I asked one of the directors of surgical services that question. You know, she told me that we were losing $35 million. I don't know what time period that's over, but I said when I have those kind of budget problems in my household, I'm looking at what am I going to do? Who's doing is something happening that I don't know about? And by the way, I've been around a while. I've heard this from Allina over and over the years. So truth is it's hard to find it, to know what is truth, it's not enough money. They're making money, but it's not enough money. So, you know, there's internal issues, I would guess, if we're losing $35 million.
And I can also speak to that a little bit. None of the physicians affected by this closure were even in the discussion beforehand. We are happy to help come up with creative solutions, but we have to have a seat at the table and be involved beforehand.
Regarding that seat at the table, I mean, I wanted to ask about this occasion, which is one of the first times the doctors have been present here side by side with everyone. Does the union vote, has it made it easier for you to stand here today and make these kinds of calls?
100%. Absolutely.
Say that at the podium?
Yes.
I can speak to that a little bit. I am one of 20 pediatricians within Allina that admits patients directly here to Mercy Hospital. And I've been in practice long enough to be here before we had pediatric hospitalists. When I was on call as the pediatrician, I could easily get a call from the emergency room. There's a patient that we're admitted to the floor. I could easily get a call from the nurses on the floor. We have a patient here that's getting sick acutely. We need you here. I was the pediatrician on call who would get that frantic phone call from some of the nurses in the nursery. Dr. Larsson, we have a 36-weeker that we just delivered. We need you here now. Hang up the phone. So that is the situation that was present before we had these hospitalists here. I can say without a doubt that having the support of my colleagues in our primary care union and in the Mercy Unity Hospital Union has made a tremendous difference. This is not an issue that is about the union. This is an issue that is about patients. At the end of the day, it is about patients, and our union has given us the ability to organize as a group to stand up for our patients and to stand up for what is right. It is right that we take care of our own children and our own community.
Are all of the speakers here today, will you lose your jobs in June if this all goes through?
I will. I'll have to take another job somewhere.
Well, I guess ultimately then is what is the plan for somebody, if anyone wants to share a specific personal story?
I guess for the pediatric hospitalists, yes, although I guess they've offered three of the six of us positions potentially. That is their current plan. And then I can't speak to the other employees who spoke today.
We're being told that we have to rebid for our jobs, so.
And I work in surgical services, and my job will be gone. So I will use my union process that is spelled out in the contract to find a job in the hospital or go elsewhere.
As one of the pediatric hospitalists that would lose my job from this closure, the three positions that they're offering as of Monday would just mostly be newborn care, and I love providing care to newborns. That is a small fraction of what we do, and I would very much miss the inpatient pediatric care that we also do here at Mercy. There's also 6 of us, and they're only keeping 3, so that math doesn't work well for 50% of us. And with all of the, it's been a trend to close pediatric inpatient units in the community hospital settings, like Maple Grove not long ago, closing their pediatric hospital beds. So just like I was speaking to kind of the care desert for pediatric inpatients, that also makes kind of a desert for pediatric hospitalist jobs. Right now, there's currently 1 pediatric hospitalist position posted in the Twin Cities, and that is at the university. A very, different place to work. It's an amazing place, but certainly not a lot of community hospital pediatrician jobs available right now. So I have to find something else. Terrible, because I love my job, and I do feel like I make a huge difference in the lives of patients and their families during the hardest time. Watching your child be sick is something that, parents and families should never have to go through, but it happens. And I enjoy being here for those families and making it a little less terrible when that does happen.
Aside from an event like today, how do you get through to Allina? I mean, is somebody at least proposing? Is somebody trying to sit down? Is there, what's your efforts?
We're here.
This is one step. Historically, decisions have been made, and we've been informed of them. Again, I would like to say very clearly that if it was not for the support of my colleagues behind me, I think it would be very difficult for Allina, for our message, those of us that are down in the trenches, it would be very difficult in the current state of things to get through to them. We want Allina to survive and thrive. We want to keep our jobs. We want to take care of patients. We want to work with the organization, with administration, to help them come up with the solutions. We're the ones that are down in the trenches doing the work. We have a lot of really, really good ideas as far as how to better take care of our patients more efficiently with high quality. Our voting the union into existence was the first step in the direction of that. This is our second step, and there will be more to come. We also are looking for community support, involvement. Let your voices be heard as well, because at the end of the day, this is about the community. This is about you. If you feel it's important for your children to be taken care of in your own community, let Allina hear your voice.
One more question. Doctors, can someone confirm, did I hear right that Unity is adding back some pediatric capacity that was initially announced as closed?
My name is Alia Sharif, and I'm one of the hospitalists who works at Unity, and I take care of ICU patients there. And I'll be happy to answer any questions regarding Unity. So you mentioned something about the number of beds at Unity. So what they're adding back, the special services unit, is very different from an intensive care unit. So when somebody ends up in the emergency room and they need intensive care services, the unit that can provide that service is staffed by specially trained nurses. And the nursing ratio in that unit is very important because you don't want that nurse to be taking care of 5 other people. These intensive care unit patients are very, very sick. So a special care unit is different in terms of staffing. It's different in terms of what it can do. And it's different in terms of what kind of complexity it can handle in patients. So in desperate situations, we use those beds for intensive care, but that is not ideal. That is not what we aim for. And a hospital the size of Unity, taking care of 150 patients, needs to have an intensive care unit with properly staffed and trained nurses available.
Thanks for your time.
I understand that there's someone from our community that would also like to say a few words.
Good afternoon. Thank you to everybody gathering in support today. My name is Alyssa Wojciechowski. I actually am a community pediatrician, so I do not work at an Allina clinic, but I work in this community as a doctor, and I'm also a mother of 3 children myself. I stand here as an advocate today for those who can't speak for themselves, the children and the infants in our community. I want to share my perspective on the closure of the pediatric inpatient service here at Mercy. As a doctor in this community, I have a great working relationship with the pediatricians here. While no family wants to have a sick child and needs to be admitted to the hospital when they are tired and stressed and worried, it is such a great option to have such quality pediatric care here at Mercy that is only 5 to 10 minutes away from home. With the loss of this access to care, it will be a much bigger strain on local families. I know many of our pediatricians spoke about this earlier, and I am here to just reiterate that. With such a long drive downtown, 30 plus minutes, plus traffic, plus parking, when you have a sick child to get access to care, that's unacceptable. Not to mention the difficulty this will pose to families who already struggle with access to transportation. To those families who struggle with access to transportation, those who need care the most, they will now lose it. As a mother in this community, I know that the closure of the Mercy Pediatric Inpatient Service will not only affect, my patients in practice, but all of our children in the North Metro community, including my own. I want to share a story with you today about one of my own children. When my youngest was 5 months old, she had a pretty common viral illness, but when she woke up in the middle of the night, struggling to breathe, not improving, no matter what I could do, I was worried. I knew she would need inpatient care and oxygen support. I knew that I could trust the care that was given here by these fantastic pediatricians, and so we came to Mercy. She was admitted here for 5 days on oxygen. I saw firsthand the great care provided by these doctors, nurses, respiratory therapists, and all the other staff here. She made a full recovery, thank goodness, and I will be forever grateful to them for all of their care. Thankfully, during this time, I had family members that were able to come and help out and watch our 2 other kids while we were admitted with our baby. Mercy is about a 7-minute drive from my house, so we were easily able to take trips back home to get necessities, clothing, food, and to see our other 2 kids who were in school at the time. And while it was a very emotional and difficult time for us, it was made so much easier by our proximity to home. I appreciate the opportunity to share my story here today. I share it as a reminder of just how important it is to have pediatric care in our community, and I hope Allina reconsiders taking medical care away from our children. I encourage anyone who can to speak up and let Allina know how you feel. And I implore Allina to reconsider this decision for all of us who live and raise families in the North Metro. Thank you.
Hi, my name is Serena, and this is Lane. I'm going to try not to cry while I tell our story. So, we live up in Isanti, which is about like a 40-minute drive from here. And back in October, Lane got sick. We thought it was just a cold. It was a Friday. We even went grocery shopping because it was just a cold. And we took him home that night. And he just seemed off. He started getting lethargic. He started kind of moaning and whining with his breaths. And we thought about putting him to bed. Because we thought it was just a cold, like nothing too serious yet. And normally he goes to bed at 7, so 7, and we're like, all right, like let's just send him to bed, see how he is in the morning. Thank God we did not, because he would not be here today if we did. So we were not going to bed. So we were like, you know what, let's just let him stay up. We'll watch him. We'll see if we should bring him to the ER and kind of go from there. Now, Cambridge, they don't have a lot to help us, but they're our closest hospital. So we kept an eye on him, and I went to change his diaper, and I noticed he had some of the rib retractive breathing going on. So I was like, holy crap, we need to go now. So we brought him up to Cambridge. They, put oxygen on him, and they were like, yeah, his oxygen's not doing good, which you wouldn't have known otherwise. I mean, he was sitting in like the high 80s. So they watched him for about a half hour, and they were like, yeah, you're going to have to go. You're going to have to transfer. And we're not letting you drive. You have to go by ambulance. And without knowing the severity of it, we were like, can't we just drive? And they were like, no. So they said that they had an ambulance coming in about 45 minutes to an hour. And, just get ready to go. So we were like, okay. They gave us the option. They said, you can go to Mercy, and because it's an Allina hospital, they can have a bed ready for you when you get there. Or you can go down to Children's, but you're going to have to go through the ER. They're going to have to reassess him before you can get a bed. So obviously we're like, well, if Mercy has a bed and they're a little closer, like, let's just do that. So that's what we did. We knew something was wrong when all of a sudden the nurse came back in about 5-10 minutes later. He said, we have an ambulance that's going to be here in about 2 minutes, and we're going to get you loaded up and out of here. And the paramedics came rushing in, and they were like, you need to get him in the car seat. And we were like, oh, okay. So we got him loaded up, and they sped us down here, and we had walked through the hospital, got to the room that he was going to be in, and he immediately threw up everywhere, and they were like, oh, okay, now we have a mess to clean. So they started cleaning it up, and they were trying to transfer his oxygen over and transfer over his O2 sensor, and it just went downhill from there so quickly. His oxygen just started going down, and we just watched it one number at a time tick down. So obviously he ended up being okay, thank God. But had we gone to Children's, which for us in Cambridge, Isani, Mora, Bram, that entire area, Mercy's our closest place. So had we gone to Children's or been forced to go to Children's, his oxygen would have dropped either in the ambulance or in the ER at Children's. If it dropped in the ambulance, he probably wouldn't be here. They didn't have the machine that he needed to get his oxygen up. And even in the ER, I mean, if we were sitting there waiting, we wouldn't have had any clue until he went limp, and then you would have been like, I think we need help a little quicker than you're giving it to us. So this closure is huge for the people here, locally, yes, but also for all of us that live in the north, because 35-40 minutes is still a long drive when your kid's not breathing, or when you have a serious emergency going on. To have to go down to Children's is literally a life or death situation for some kids. I mean, it would have been probably a death situation for him. So I think it goes so much further than just what's here, because there's so many people north that this is our only option. And Children's is just not an option for everyone. So we just wanted to share his story because it's big, it's important. Kind of ironically enough, Dr. Bender was actually his doctor while we were here.
He's got him under cold.
It's teething.
Yeah.
So, yeah, I mean, the care here, it really is life or death, and it's not a it's not a small decision to close something like that, especially for people who live farther away. So, just wanted to share our story.
Thank you.
Thank you.
Yeah, hi, I'm Dr. Lisa Schweiger. I'm a pediatrician at Cambridge Medical Center that she was just speaking about. I'd like to talk just a little bit about how Allina seems to have become very metrocentric. Not all of our patients live in the metro. Not all of our patients can easily obtain care in the metro. I've been a pediatrician in Cambridge for 20 years. We used to do all kinds of admissions. In fact, when I first started at Cambridge, I would have easily admitted that child at our own hospital. We can no longer do that there. Also, about almost 2 years ago, Allina decided to close our labor and delivery unit in our nursery, expecting all of our patients we have patients that come even from an hour north of us. They want them all to come down here to Mercy now, which is definitely not okay. I can't even tell you how many patients' lives we saved while we were doing labor and delivery services. I can think of many each and every year over those 20 years I was here or doing those services that wouldn't have made it to Mercy if they were expected to do that. There's been 2 other regional hospitals through Allina that also they closed the labor and delivery units on at Hastings and River Falls, Wisconsin. We did complain a lot about this issue, and in the meantime, the doctor who was in charge of those decisions left Allina, and so far there haven't been any more labor and delivery closures, thank goodness. But this is just another example of, now all of our pediatric patients come down here. Our very serious patients that have rare or extremely serious issues go to children's in the metro because they have all the specialists. But we do depend on them for basic hospital admissions, and if they weren't available, it would be a huge detriment to our community. We asked that Allina would change their mind on this. It's just people that live outside the metro matter too, and children matter as well, and we need to go back on these decisions and start valuing these other patient populations. Thank you.
Thank you so much to our speakers and to everyone who came out to support us today. Thank you to the members of the press who for paying attention to this important issue. As healthcare workers, we have the privilege to care for people during a stressful and vulnerable time. We also have the responsibility to advocate for patients when access to vital services in their communities is threatened. And that's why we're here today. We urge Allina to reverse these closures immediately. The health of this community is at stake. Thank you.